Welcome to Petability. I'm your host, Kathy Simons.
And I'm your host, Chris Cranston. Our podcast provides interviews and information to help your pets live their best lives. Good morning, Kathy. How are you this fine day?
Good morning, Chris. I'm doing well. How are you?
Splendid, splendid. We dodged another snowstorm here in New England, and that makes me super excited that the snow is shoveled, and we have a wonderful guest with us today.
Oh, I know. I'm really excited about this. I have so many questions, and we're going to be talking today with Dr. Riggs about cognitive dysfunction. And my very first dog, I had my first pug, Buddha, started having cognitive decline probably around the age of 12, and so I'm really interested to hear what Dr. Riggs has to say about what these dogs are experiencing.
Me too. And as I was preparing for this chat, I was thinking, over the years, I've been doing this for almost 20 years as a canine rehabber. And I remember early in my career, it was like, what? Dogs can get dementia? What are you talking about? Right. And now many owners, like I just talked to one a day or two ago, and she said, I think my dog has dementia. So we've kind of spanned, I guess, that thought process and research, and it's becoming more, owners are becoming more aware, and we're hoping to get some good information out there, dispel some of the myths. And I always think that information and education really empowers us as pet owners to be better equipped to care for our furry loved ones.
Right.
So I will introduce the esteemed Dr. Bronwyn Riggs. She is originally from the South Shore of Massachusetts and received her undergraduate degree in biochemistry from Smith College, smarty pants, before pursuing her veterinary degree at the University of Pennsylvania. After graduating in 2010, Dr. Riggs completed a rotating internship followed by a 3-year residency in neurology and neurosurgery at the Animal Medical Center in New York City. Dr. Riggs became board certified in 2015. I just want to take a little brief moment here to say that those credentials are astounding. And our listeners know that I am a fan of the Animal Planet show, broadcasts, and they're always at the Animal Medical Center in New York City because lots happens there. So that's really cool. Dr. Riggs takes pride in being a conservative surgeon who performs surgery aggressively when needed, when it's indicated. But her primary interests are in diagnostic MRIs and finding non-surgical options for complex neurological diseases. Dr. Riggs also enjoys performing advanced neurosurgical procedures. And again, I always tell my clients that a good surgeon is one that doesn't just automatically say your pet needs to go under the knife. So I really, really appreciate exploring more conservative non-surgical options when they're available. So welcome, Dr. Riggs.
Welcome, Dr. Riggs.
Thank you for having me. I'm pretty excited about this topic for a couple of reasons, but almost first and foremost is that this was a topic that I explored during my residency when I was at the Animal Medical Center. So it's always good to sort of continue this discussion so that we're bringing more information to not only veterinarians, but also to the, people and more important people in our lives that are taking care of our pets.
Mm-hmm. Dr. Riggs, I'm going to jump right in here and ask if you can you define cognitive dysfunction for our audience? We've heard this term, right? But what I'd like to know is, can you tell us not only what is cognitive dysfunction, but what are these animals experiencing, right? What is happening to the brain?
Absolutely. And so I think even before we talk about cognitive dysfunction, that we can back up a little bit further and just sort of recognize that, with advances in veterinary medicine, we're more and more commonly seeing our pets living to a greater age than has been seen historically. And so with a longer lifespan, we see age-related degenerative changes in a number of organ systems. And that's going to include our heart, our vascular system, our musculoskeletal system, our endocrine systems. And so with all species, the brain also undergoes degenerative changes with age, and this is going to result in an impairment of memory and learning. Now, what we know with cognitive dysfunction in our pets is mainly through the study of dogs and to a lesser degree cats. So I apologize if I'm mainly referring to dogs, but it's just that the bulk of what we know sort of focuses or is really sort of geared around sort of the study of dogs. So when we talk about the definition of canine cognitive dysfunction syndrome, we see it as a progressive neurodegenerative disorder of senior dogs that is characterized by a gradual decline in cognitive function. And that's going to be as it pertains to things like learning, memory, perception, and general awareness. And this usually occurs over a prolonged period of time, so like 18 to 24 months or even potentially longer.
So it seems like we've established that dogs in particular, but most likely it can be extrapolated to many species, get cognitive dysfunction. And just for our knowledge, is the term cognitive dysfunction the same as dementia, or like in people, everything gets thrown into this lump of Alzheimer's disease?
That's a great question. And the short answer is yes. However, the more interesting answer sort of involves discussing some of the neurobiology behind brain degeneration. So all species are susceptible to neurodegeneration as we age. And this is true across all organ systems, but due to the high metabolic needs of the brain, this degenerative process can be more rapid. So if you remember from your seventh grade biology class, mitochondria, or the powerhouse organelles of the cell, they create ATP through aerobic respiration. And a byproduct from making ATP occurs through the breakdown of oxygen into reactive oxygen species. Now, normally the body has defenses against these toxic byproducts in the form of natural antioxidants. However, if balance of detoxification and production is tipped in favor of overproduction, as can occur with aging, the excess of these free radicals can react with really important structures within our cells, such as DNA, lipids, and proteins. And this can lead to cell damage, dysfunction, mutations, cancers, and even cell death. And so what makes one individual more susceptible to this form of aging over another individual can be multifactorial. So things like genetics, diet, environmental factors, lifestyle, and metabolic diseases, all these things can play a role in how the brain ages. Now, the hot topic is, how is cognitive dysfunction as we see in dogs cannot be related to Alzheimer's disease. So to get into that, we'll talk a little bit about Alzheimer's disease and sort of what we, again, I'm going to do it on a basic level just because, again, I'm not a human physician. However, I'll then sort of relate it to what we know in dogs. So Alzheimer's disease is a condition in humans that is recognized through two hallmark pathologies within the brain. So you can have something called beta amyloid plaques and something called neurofibrillary tangles. And these substances are neurotoxic, so they can lead to neuron dysfunction or cell loss and depletion of neurotransmitters, which are the really important substances that tell the cells how to communicate, or they allow the cells to communicate with each other. So this leads to progressive loss of memory, confusion, disorientation, and difficulties managing one's environment. And in later stages, coordinated muscle movements and appetite can also be affected. Now, in dogs, beta amyloid proteins have been recognized within the brain. Now, in people, these usually form as dense plaques, which can then lead to what we associate with Alzheimer's disease in people. These dense plaques that occur in people are not seen in dogs, but the presence of these proteins is still correlated with severity of clinical signs. It's just not as definitive as a causative agent for decline. Now, neurofibrillary tangles, which again is seen in people, are not consistently seen in dog brains. So although there are some similarities in some of the pathology seen in humans with Alzheimer's disease, it does not translate directly to what we know in dogs. For this reason, we stick with the term canine cognitive dysfunction syndrome as opposed to saying that they have Alzheimer's disease.
Dr. Riggs, I wanted to touch on something that sparked my interest when you were talking earlier about our pets and how they're living much longer. And I agree. I started, my technician career probably back, I don't want to date myself too much, but in the mid 80s, right? And if we saw dogs that were living, 8 or 9 years, 10 years even, we thought that those were, really good numbers. And now I'm seeing dogs that are living, into their teens, and occasionally, very rarely, but occasionally I'll see a dog that makes it, to 20, some of these small dogs, right? And so what I'm wondering is, how do we recognize this as a cognitive decline? So as I'm getting a dog that's 12 or 13 or 14 years old, maybe they're starting to have some type of sensory impairment, right? Maybe they're losing their vision. Maybe they're losing their hearing. How do we determine, or what's the diagnostic criteria for saying our dogs are truly in cognitive decline?
So that's a really great question. And a lot of times we need to rule out a lot of medical conditions that could be causing some of the clinical signs that we associate with cognitive dysfunction to make sure that there isn't an underlying medical problem that is causing those sorts of clinical signs. So it's always the first sort of rule of when you have a dog coming into the office that is showing potential signs of this, to make sure that they aren't sick for another reason. And this is how the behaviors are manifested. So
you mentioned the plaques in people and not so definitive in dogs or animals. Is MRI a diagnostic for this? And can pets get early onset as an outlier?
Absolutely.
Like people can.
So doing a number of tests can really help to screen for a potential cause for some of the things that we associate with cognitive dysfunction. So doing general lab work to check out your pet's overall systemic health is very important in that. Doing things like checking blood pressure, like what you would do, if you go to, your doctor to check your overall health, can also be important information in sort of the puzzle that is your pet. And then finally, when we're evaluating the brain, we have more specific tests like MRIs to look at the structure, the architecture of the brain, so that we can help to rule in and out a lot of different conditions, because things associated with cognitive dysfunction like disorientation, confusion, changes in behavior, that can arise from a number of diseases, both within the brain as well as outside of the brain. So the MRI, or doing that systemic workup, and then eventually an MRI, can really help to look for each of these different conditions. So doing the MRI allows us to look at the structure of the brain to see, do we see anything that could be consistent with, say, a brain tumor, or that my pet has sustained a stroke or vascular event, looking for evidence of inflammation or infections. And in the absence of some of these things, we start leaning more towards the diagnosis of cognitive dysfunction. Now, there are some age-related changes that we can see affect the brain that show up on MRI. And so that can also help to support, that diagnosis.
You had talked about we had covered the possibility of other things being the cause of some of this, what appears to be a cognitive decline. But you had also mentioned that one of the factors in cognitive dysfunction, or one of the things that we should consider is the lifestyle of the dog. Is there any particular thing that you can think of that would make maybe one dog who's maybe is a dog that's sedentary and obese? Is that the particular lifestyle of a dog that may make them more at risk for cognitive decline than, your border collie who's running after sheep all day?
I think this is a really interesting thing to think about, mainly because it's also a hot topic in the human community. So, there are a lot of studies out there that discuss the advantages of exercise, both physical as well as mental, and how that really helps our overall cognitive function. I find it hard to believe that you couldn't apply those same principles to our pets. Now, it's harder to follow that within animals, mainly because the studies that are done in people are done within a laboratory to a certain degree, a much more structured setting. Whereas within our pets, there's so many variables that come into play. However, I'd like to believe that the animals that are, undergoing exercise and have a lot more stimulating environments are more likely to maintain that level of function, as opposed to those who have a more sedentary existence. Unfortunately, the studies for that just don't exist. So we just don't have that data, but something to certainly explore in the future.
And I guess we go back to, also everybody's an individual and genetics are going to play. You can't necessarily, rule that out. The guy who goes running every day could still get, Absolutely. Get sick. Right. In my early years as a rehabber, I had a woman come to me with her 17-year-old, she's small. So like a Yorkie poodle mix. Right. Mm-hmm. And nobody wanted to touch the dog because they were like, oh my God, she's 17. I was like, no, I want to work with this dog. And the owner came in and said, I want to focus not necessarily on my dog's fitness, because she was pretty fit and in trim and she was doing pretty well and going on her walks, but her owner called brain fog, right? And I was like, I don't even know what that term means, and I don't know that I can treat that. But what I did was I came up with a series of regular routine exercises and brain games. So problem solving, right, throughout the day, games, toys, things that she had to, forage, or the foraging box, or her brain game toys, and a set of routine exercises that would happen periodically throughout the day. And I can say anecdotally, that dog did really well. And she just about made it to her 20th birthday. Wow. And she showed some decline in that last 3 months. But I could say for that particular dog, I really felt like rehab or that physical activity and just getting her to problem solve. Plus, she was a smart dog anyway. Little terriers, how smart they are, right? Smart, they really, really smart. It seemed to really smart. She was a little too smart. But it really did seem to help, And of course, that's just one patient, but that was the experience I had with that dog.
Absolutely. We definitely see that enrichment that focuses on positive social interactions can really benefit the pet, but also the human pet bond. So, doing, opportunities for exploration or interactive games, stimulating ways to obtain food or toys and treats, all those things can really help to keep your pet going. Mm-hmm. So, there are treats out there that, have them sort of pushing or lifting or sort of, batting at a toy or making it roll to release food. And these things can encourage the pet to be more active and alert, or, things that like scattered treats, that's helping your pet to learn or even relearn to hunt, search, and retrieve. And again, it's just keeping the pet more active and stimulated that only is going to benefit things and going forward.
And it's so much fun for them. There's so many great, fun, simple things that we can do with our senior dogs, right? There are just so many fun games. There are new games, toys, things that you can invent, crawling under, walking over, finding food. There's just so many great things. And I think that also the touching on the animal-human bond is really important, because that's what it's all about, right? And the animals getting special time with their owner. I think that probably is a factor too. So.
Yes, and even in doing these games, we're also helping to reinforce a normal sleep-wake pattern, which is one of the things that can really be to the detriment not only of the pet. So, as we age, it's really important that we sleep soundly. It's important throughout life, but especially true as we age. But also that sleep disruption also affects the family, which is going to impact that bond. So having these interactive or sort of designated playtimes, going on shorter but maybe more frequent walks to help maintain mobility and stimulation through low impact exercise. These things are going to really establish a more normal sleep and wake pattern that are, that's going to be more likely to be active during the day and then hopefully sleeping at night. And along those lines, doing that final play session or a walk just before bedtime can really help to encourage a better nighttime sleep.
That's an excellent point. I didn't even really think about the sleep disruption, and, our dogs don't sleep like we do. They take little short naps throughout the day, and then they need to get that good sleep, that restorative sleep at night.
Makes me think
I think an example of that, and it can creep up on people. I think that is one of the tougher things with cognitive dysfunction is that these clinical signs in people we'd call them symptoms. So in veterinary medicine, we call them clinical signs, but they can be much more subtle earlier on in cognitive dysfunction and then very gradually change over time. And as a result, people, if they're sort of gradually exposed to this, they don't always recognize the changes until they're much more advanced. And an example of this was when I was actually in veterinary school, my childhood dog, her name was Emma. She's a Springer Spaniel, and she's a wonderful, wonderful dog that, fortunately was very, very healthy for most of her life. But anyway, I wound up going away to veterinary school, and she stayed with my parents. And I wound up coming back during, one of our breaks, and I hadn't seen Emma in many months. And when I came home and was staying with my parents, I all of a sudden I heard, this sort of commotion at night, and it turned out it was Emma that was starting to vocalize. And, I spoke to my parents, about it in the morning, and they just sort of shrugged it off. They're like, oh yeah, she's been talking at night. And I was like, okay, how long has this been going on for? And it turns out that it just had sort of gradually been occurring, and it didn't even register on their radar that they were waking up at night to sort of check in on her and see what was having her agitated. And sometimes it was that she, needed a bathroom break, but other times she genuinely was just sort of confused and a bit disoriented and just needed help settling back down. And again, until I really pointed it out to my parents, they didn't even realize that there was a change in the normal pattern.
Yeah, that had become their new normal.
Exactly. Yeah. And they just, adapted to her needs. And, I think that happens with a lot of our really great pet owners is that, they just sort of like a toddler needs help with certain things. The parents rise to the occasion. Well, as our pets get older, they almost revert back to sort of being puppies again in the sense of what their needs are. And it can be a very gradual process. And people just sort of say, oh, well, my pet needs this. And so now I'm going to do this, and don't really realize that there's been a change to the normal pattern.
So, Dr. Riggs, I've heard the term Sundowner Syndrome, thrown about, and that certainly occurs in people. And, once again, I started as a physical therapist with people. And, in simple terms, I would always think that these folks kind of mix up their day and night. And so they're awake during the night and asleep during the day. Is this insidious onset of some of the things you're describing, would you equate that to being like a Sundowner syndrome?
Yeah, so I do think that we can see that to a degree in our pets. So it is a term that we'll sometimes adopt for, you name the species, but there's this transition from daylight hours to evening where the individual becomes more agitated or restless or sort of confused and disoriented. And that's what we're talking about with Sundowner Syndrome or sundowning. And we definitely can see that with our pets. I generally find that it sort of continues on into the nighttime, where again, they tend to be more active at that time, confused, pacing, sort of repetitive behaviors, whereas during the day, they were sleeping more soundly.
Yep. Gotcha. So I want to maybe give our listeners some very concrete signs, behaviors that you've noted, over time, that they can maybe look for that may be indicative of cognitive decline. I know for me, what some of my clients have described is, and I have dear friends who have, I think he's a 13-year-old mini schnauzer. And we were Zooming the other night and they said, Chris, we want to ask you, about this. Rudy he's going to the wrong side of the door. He's gone out the door to go outside, on the appropriate side every time. And now lately he's going to the wrong side and we have to kind of scoot him around the door to get him out. And the other thing that they mentioned was that he's not localizing, I guess, where they are. Like when they call his name, he looks 180 degrees in the opposite direction and just stares. And I don't know, would those be some signs that would be typical of cognitive decline?
Absolutely. Yeah. So some of the things that we can see involve changes seen with just disorientation and confusion. So like getting lost on a walk, especially a walk that they typically take or have been taking for years, or looking for the food bowl or water dish in an unusual place in the home. I like the example of, going to, sort of the wrong end of the door to be let out, or maybe going to the window instead of the door to be let out when there isn't a visual impairment that's affecting them. Now, other times we can see changes in social relationships, such as losing recognition of people that they should know, like neighbors or even members of the household. And then, we touched upon things like alterations and the sleep-wake cycle as being a big one, where they sleep more during the day and then are pacing or restless at night. Things like loss of learning and memory, which oftentimes results in house soiling or loss of learned commands and trained tasks. And you can see these changes in activity, such as wandering and repetitive movements, or even decreased activity or responsiveness to normal stimuli. And then finally, another big one is just an increase in overall anxiety or phobias. So maybe a dog that always was a little bit prone to being anxious, all these things, this is now much more heightened later on in life.
What is the part about when you said may not recognize a neighbor or a family member? How does that manifest? Like, do they bark at them? Do they cower? All of the above?
Yeah, sometimes it can manifest as vocalization, barking. Other times you can see aggression. And again, it may be someone that they should know that, they spent a lot of time with in the past. Or, it can be, a dog that usually is well adjusted, that is used to being introduced to new people, that all of a sudden has these new fears with being introduced to new people or situations.
And I think, again, getting this information out there will help to decrease some of the pet owners' anxiety around this. So if they're seeing some of these signs, maybe it won't be quite so upsetting because they're understanding what's going on. And maybe they can help to allay those fears or that anxiety versus just being really upset. Like, why did Fluffy bite me? She's never bitten me before, that kind of thing.
Right.
Yeah.
And I think an important part of that is also the importance of keeping keeping their environment as consistent as possible. So, maybe the puppy, the younger dog, the middle-aged dog that, enjoyed going on car rides or having new experiences, that may not still apply to the older pet who, is now to having anxiety. So keeping the day-to-day pattern as consistent as possible is going to go a long ways towards, having a more sort of calm day-to-day life experience.
And I think it's important to perhaps clarify here that yes, routines are definitely beneficial for the reasons that you stated, to decrease anxiety so they know what to expect and so forth. But that is not to say, as we talked about earlier, that introducing new things that are enriching, whether it's DIY stuff or, feeders and toys that you buy that can help stimulate them, that does not exclude that. So maybe an example would be, at 3:00 in the afternoon-ish, I get out, Moxie's toy ball and put some treats in it, and Moxie gets to play with that ball. So there's an enriching activity, but the routine is that it's roughly at the same time every day and so forth. Is that fair?
That's incredibly fair. And I think that the big take home to this is you got to tailor it to your pet's needs. So if your pet really enjoys these sorts of play sessions that involve a certain thing like a ball or, a treat dispensing toy, then fantastic. However, if that same toy now is causing anxieties, then it's probably not a good idea to continue play with that, but to find something else that maintains a calm environment that still is stimulating.
Kathy and I always say, listen to your pet. And that's a perfect example.
Yeah. And I think that, from the owner's perspective, for somebody, I've been through it once with one of my dogs. I think that I wanted to point out that from my perspective, the way I felt was almost a little bit of a grieving process that my dog was having this decline. And that it was a little bit sad that I saw that he didn't want to participate in some of the things that he used to love, right? He used to love swimming. And then at some point he was like, I can't get wet. Right. So, for me, it was a little bit sad, but what I did, again, Chris, like we talked about and Dr. Riggs talked about, was, I made sure that we had a set of routine. We got up at the same time every day. He could count on going to the bathroom at the same time every day. I found something to do with him that he enjoyed. And then we just had this new life, our new normal, our new lifestyle. But, can we talk about other things that might help treat or slow or maybe even possibly reverse some of this cognitive decline? Is there anything out there for us, supplements, anything?
Yeah, so I think that even just sort of the broader topic of saying or asking, is there a treatment for cognitive dysfunction? It's important to realize that there are no definitive treatments for reversing or curing a decline in cognitive function, but rather management of this condition is reliant on, a multitude of things, including behavioral modification techniques, environmental enrichment, targeted nutrition, and medications that may slow progression of disease and improve the quality of life of the pet and family. And then, ultimately, it's also making sure that there aren't underlying medical problems that need to be addressed. So, we've talked a bit about mental stimulation, going on walks, doing various toys to help. But there are some other things that can help with anxiety. So there are actually anxiety wraps or thunder shirts that are available on the market. So just like swaddling a baby can provide a sense of security.
That thunder shirt. I love the thunder shirt. I love that thing.
Yeah. So these wraps can be helpful for some dogs that are experiencing phobias and agitation. So that's something that some people, again, if it's something that their pet enjoys, it can be very helpful. Obviously, if they don't want to be swaddled, then it could cause more harm than good. Now, there has been a fair amount of research that's gone into brain-specific diets in the hopes of improving cognition or at least slowing down its decline. And these are typically geared towards supplementing antioxidants and other ingredients to enhance mitochondrial function. Other diets focus on metabolism through alternative energy sources like medium chain fatty acids. Regardless of whether you choose a brain-specific diet or not, just making sure that you have your pet on an age-appropriate and well-balanced diet is going to go a long ways towards ensuring your pet's overall health. There are also a lot of supplements available that can help on this subject. So S-adenosyl L-methionine, or SAMe, can help with cell membrane fluidity and receptor function. There's also been, there's a product that uses apicorin, that's a calcium buffering protein. It may have some neuroprotective qualities to it. Even things like ginkgo biloba, they also help with free radical scavenging. So again, we're really trying to help with sort of brain metabolism and some of those byproducts that can be damaging to the brain. Now, targeted therapies try to focus more on managing certain aspects of cognitive decline. So things like melatonin can help with regulating the sleep-wake cycle. Things like selegiline or fluoxetine, so Prozac, can help with anxiety. And then I sometimes even use gabapentin to not only help as a bit of a sleep aid, but also if there's any underlying discomfort, as we can see in our older pets from things like arthritis, it could potentially also help from that perspective as well.
You know, I keep going back to my experiences with people. And ironically, I just spoke with my dad last night. He was diagnosed with Parkinson's several years ago, but he just saw his neurologist and was just put on a medication to help with memory. And so how timely is this chat? Yeah. I'll have him listen to the podcast. Maybe.
Please do. Yeah, see what he thinks. Dr. Riggs, do you think that there are any great maybe adjuncts to traditional medicine that you might consider for these pets with cognitive dysfunction and acupuncture, something like that?
So I think it's a great thing to think about, always thinking outside the box. Don't, just get pigeonholed into certain, aspects of medicine, but sort of consider some of the alternative treatments out there. And, I know that acupuncture has directly, helped with cognitive function? Not necessarily, but I think that acupuncture definitely has its place in medicine and certainly can help with a lot of painful disorders, and that those can cause decline in the overall well-being of the individual. And so if you can help to improve one aspect of one's quality of life, I can't imagine that it wouldn't help in other aspects as well.
Mm.
I have a little anecdote to share. Just recent, about 2 weeks ago, I was referred a dog that was turning 15 on the day that she was coming in for her physical rehabilitation consultation. And the one thing that, well, I guess there were two things that the owners said in their goals, but the first thing they said was to help her in terms of her mopiness and to make her excited about life and so forth. And then the other was to address any pain or discomfort that she may be having, as she ages. And, kind of to Kathy's point with her story earlier, this dog was in fantastic physical shape. Yeah. And I hate to say for 15 years old, because she is in great shape, even, for a dog that might be 8 or 10. And she has wonderful owners that are very committed and so forth. But what came to light during the course of this consultation was that Lilu used to participate in agility. And the owner was just kicking herself because as I was describing some of the things that I wanted her to do with Lilu, she's like, oh my gosh, she used to love that. Oh, we did that all the time. Oh, she knows how to do this. And I'm thinking of it more from a physical point of view, like maybe doing some figure eights and weaving to help to loosen her spine, which was just a little stiff and so forth. But the owner recognized that, these are things she's like, she knows how to weave. She used to weave and, rock that all the time. So fast forward 2 weeks, and I just saw this dog on Sunday, and the owner reported that there has been a 180-degree mind shift for Lilu. She is happy, animated, interacting, and in the middle of her exercises will take off and do zoomies because she is so excited to be doing and rather simple things. I didn't, assign anything, that was too difficult, considering her advanced age and so forth. But, sometimes I love working with the older pets because sometimes it's just a little shift in their lifestyle can make such a huge impact on how they're just doing both physically and mentally, because you can't really separate the two. I think that's one of the things I love, and Kathy and I have talked about this is when you're doing physical exercise with the dog, you're also exercising their brain.
Yeah.
And I think the other thing that comes with that is, so you as a physical therapist is going through this, but also the pet owner a lot of times are bringing these lessons home and working on their pet. And in doing so, it continues to strengthen that bond between the pet and the owner. And so it's perceived both ways. The pet is happy because it sort of has purpose again. It's doing the things it likes to do, but the owner is also happy because it's interacting in a positive way with their pet and seeing their pet happy. So it's definitely a win-win.
Absolutely.
It's the best when you see an owner and a pet sort of find a commonality of joy, right?
Yes.
That's the best feeling when they find something that they both enjoy and
it was so
joy.
obvious because the owner came back, to this visit just beaming as well.
Mm-hmm.
And there are 2 other dogs in the household. And I just think by default, this owner had, she's taking her other dog to mobility class and, doing different things, but she just needed that reminder from me that Lilu is capable of doing this. And, to both of your points, it just brought such joy to both of them. So win-win.
That's great. Win-win.
Definitely.
So Dr. Riggs, as we're wrapping up our little chat today, I just want to touch base again on, is there a typical age of onset for these cognitive changes? And is it more common in certain breeds of dogs? Or I know you said there's not a lot of research on other species, but maybe you can speak to breeds of dogs that it may be more prevalent in.
Sure. So the median lifespan of dogs varies as a function of breed, with larger breeds typically having shorter lifespans than their smaller counterparts. So it is difficult to peg when exactly a dog becomes geriatric or of an age when cognitive dysfunction may be more prevalent. Now, that being said, cognitive dysfunction is reported to arise with increasing frequency between the age of beginning at the age of 11 years of age. However, evidence suggests that a decline in cognitive function may occur much earlier than typically reported in the clinic, likely because of limited diagnostic measures, because it's such a subjective thing to identify. So these initial signs can be subtle and relatively innocuous, but may progress to a point where they have a significant impact on the pet's quality of life and the owner's ability to continue to care for the pet. Now, in the laboratory setting, cognitive dysfunction has been identified as early as 68 years of age. So what that tells us is that hopefully by being a bit more vigilant about what our pet is experiencing, hopefully by identifying maybe the earlier signs of it, we can then intervene much more quickly to hopefully help slow progression of disease as our pet gets older.
You know what I would love to see it. And I think that we're moving towards this. I would love to see more veterinarians refer their senior patients to rehab in general, maybe even just in this first signs of maybe cognitive decline, because this is a time when owners can lean on their rehab team, right? This is something that they can lean on their rehab team for.
I would love that too. I think it could go a long ways towards to really help deal with this problem.
Right.
That to a degree is a little bit inevitable, fortunately, as our pets are, getting older and older.
Yeah. And you know what, I think a lot of it is, and I'm excited to see it. I feel like a lot of that is client driven. Clients are they're looking for what they can do that's going to be in the best interest of their pet. They're looking for things that they can do that are going to be helpful, and they're looking to participate in their animal's health care.
I have check boxes on my referral form, and they're all related to physical problems like loss of range of motion, decreased flexibility, diminished strength. I am going to add enrichment as one of the check boxes, because one of the doctors, the veterinarians that refers to me quite frequently, always has to write that in other because she's aware of this. And I agree, Kathy, that this is right up our alley in terms of, providing that stimulation and along with the physical
guidance.
Exercise. So
yeah.
I think that would be great. And also by having it as a designated thing to think about, either as, the client coming in or the referring vet considering what their patient needs. Hopefully it's more likely to be addressed if we don't have those visual reminders. And again, if it's something that's chronic or, somewhat subtle, then we're less apt to address it.
What I think, again, of with people seems very parallel to our pets in that, there are measures that we can take. And the big three that I think of are, socialization, exercise, and brain games, and people, Sudoku, got a lot of press, but I think people don't realize that chasing a treat dispenser around is a brain game for their pet. And, again, doing something physically different. So I know, like, you're supposed to brush your teeth with your opposite hand because it makes your mind think differently. And I end up poking the toothbrush in my eye, but that's a different story. But, I think as long as, to Dr. Riggs' point, we don't increase anxiety, we listen to our pets, don't be afraid to experiment with these things and try to promote all of those things, the increased bonding, socialization, appropriate physical exercise, and the enrichment and mental stimulation.
Right. Definitely. Yeah, that's a good point. Well, this has been amazing. This was a great show. I think this is going to be really helpful for our listeners. And Dr. Riggs, before we go, is there anything you'd like to leave the audience with? Any closing remark? Any ideas? Anything that you'd like to take away for owners?
Sure. It may be a little bit cheesy, but if old dogs lose their tricks, try teaching them new ones.
Oh, it's beautiful.
Yep. Yeah.
That's perfect. That's perfect.
Exercise that brain muscle.
That's right.
Yeah. And just always remember that treatment often requires a multimodal approach. So there's not going to be an easy fix or, a magic pill that's all of a sudden going to bring your pet back. It requires, intervention that, it involves the environment with, your diet, with, how you interact with your pet, and, what you can do with exercise. So, don't think of it as just a problem that should be addressed just with medicine alone. There are a lot of ways we can approach this problem, and that should be approached.
That's a fantastic takeaway. Dr. Riggs, for our listeners, can you tell people where they can find you?
Yes. So I'm at Massachusetts Veterinary Referral Hospital, which is in Woburn, Massachusetts.
And we will be putting, as always, some links with our show notes on the Petability Podcast website in terms of, things that you may be able to find, for example, the Thunder shirts, if you think that might help your pet, and certainly the website for Massachusetts Veterinary Referral Hospital.
Yeah, and we can probably put up a link for finding some of those really good, brain games too. We'll put up a link for those too.
So my take-home message, my final words, is yes, you can teach your dog new tricks. Thank you, Dr. Riggs.
Thank you, Dr. Riggs, for joining us. It was great to talk with you.
That was a pleasure.
Thank you for joining us. We hope you enjoyed our show. Follow us on Facebook or on Instagram at Petability Podcast.
For more information about Kathy's books and living with blind dogs, please go to enableyourpet.com. Thank you, and please tune in next time.